first case of Ebola now here in the United States. The Centers for Disease Control and Prevention confirming the first American case of the deadly virus now being diagnosed at a hospital in Dallas.
This is something that we take very seriously. As soon as there's an outbreak anywhere in the world of any disease that could have significant effects, the CDC is in communication with the World Health Organization and other multilateral agencies to try to make sure that we've got an appropriate response. This has been a more aggressive Ebola outbreak than we've seen in the past. We're taking the appropriate precautions. Folks who are coming from these countries that have even a marginal risk or an infinitesimal risk of having been exposed in some fashion, we're making sure we're doing screening on that end as they leave the country. We'll do additional screening when we're here. We feel confident that the procedures that we've put in place are appropriate.
Passengers arriving in the U.S. from West Africa are currently not being screened, but public health officials have put hospitals on alert. They say any outbreaks will quickly be brought under control.
Keep in mind that Ebola is not something that is easily transmitted. That's why generally outbreaks dissipate. But the key is identifying, quarantining, isolating those who contract it and making sure that practices are in place that avoid transmission. And it can be done, but it's got to be done in an organized, systematic way.
So the U.S. missions in the affected areas have distributed messages to U.S. citizens regarding the Ebola attack. And those missions are closely monitoring the situation, continue to keep American citizens informed of what's happening.
World health experts said today the Ebola outbreak in West Africa is out of control. And the head of the World Health Organization warned of what she called catastrophic consequences if it continues to deteriorate.
Now, the latest on the Ebola outbreak in West Africa, which is moving faster than efforts to contain it. The disease has struck hard in 3 countries, Guinea, Liberia, and Sierra Leone, which is the epicenter. A Liberian government official who had flown to Nigeria's largest city, Lagos, died of the disease in a hospital there.
For the first time, doctors are treating a case of the deadly Ebola virus here in the U.S. An American aid worker infected in Liberia was flown to Atlanta Saturday and is now being treated at Emory University Hospital there. Another American aid worker will be flown here in the next few days.
Dr. Kent Brantley arrived at Emory University Hospital midday Saturday wearing a protective suit but walking under his own power to this special isolation unit, one of only 4 in the country. This is the first active case of Ebola in North America. The disease has no known cure and kills up to 90% of those affected.
Dr. Alex Isaacoff was in charge of transporting Brantley through Atlanta's streets. He was in that SUV behind the ambulance. He says there is no risk to the public.
If I had Ebola and I was touching your hand, maybe you would be at risk for contracting it. If I coughed and sneezed in your face, you would be at risk for contracting it. But that's how it's transmitted.
Emory's 3-bed isolation center has a highly trained staff and special equipment to keep these pathogens from getting out. There are only 4 centers like this in the entire country.
Colonel North, in your work at the NSC, were you not assigned at one time to work on plans for the continuity of government in the event of a major disaster?
Mr. Chairman.
I believe that question touches upon a highly sensitive and classified area, so may I request that you not touch upon that, sir.
I was particularly concerned, Mr. Chairman, because I read in Miami papers and several others that there had been a plan developed by that same agency, a contingency plan in the event of emergency that would suspend the American Constitution. And I was deeply concerned about it and wondered if that was the area in which he had worked. I believe that it was, but I wanted to get his confirmation.
May I most respectfully request that that matter not be touched upon at this stage. If we wish to get into this, I'm certain arrangements can be made for an executive session.
Back to Obama's magic pen.
He signed another executive order today, and this one is going to allow for the detention of Americans with respiratory illnesses. Now, of course, this is all coming on the wake of that Ebola scare, and this executive order is titled Revised List of Quarantainable Communicable Diseases, and it amends an executive order that was already in place, passed by George W. Bush in 2003. It allows for the apprehension, detention, or conditional release of individuals to prevent the transmission or spread of communicable diseases. Well, Obama's amendment will allow for the detention of Americans who just display acute respiratory syndrome. So with the exception of influenza, anyone can be forcibly detained by medical authorities.
Now let's bring in the director of the Centers for Disease Control, Dr. Thomas Frieden, to talk about the outbreak and the decision to bring the Ebola virus to the U.S. for the first time. Doctor, can you categorically say that the risk of bringing these two highly infectious people across the Atlantic and here into the U.S. is worth the risk, both to the patients and to the public?
The decision to bring this doctor back home was a decision of the organization that sent him to Africa. He was ill there. They wanted him to come here where they felt he could get the best quality health care, and that's their decision.
The White House said government officials were working to get 2 Americans with Ebola out of Liberia.
These kinds of medevacs that are performed by private entities, by private organizations, yet facilitated by the U.S. government and government agencies, is consistent with what has been done in similar situations in the past.
Brantley is the first of 2 American Ebola patients to arrive in Atlanta aboard this air ambulance chartered by the Christian International Relief charity Samaritan's Purse.
Obviously, Franklin Graham, who's head of Samaritan's Purse, in close contact with the officials at Emory University as well.
Law ever become a reality in America? Some fear any nuclear, biological, or chemical attack on U.S. territory might trigger just that. And as KSLA News 12 Jeff Farrell discovered, the clergy would help the government with potentially their biggest problem, us.
From my cold, dead hands.
Charlton Heston's famous declaration captures a truly American value, the overarching desire to protect our freedoms. But gun confiscation is exactly what happened during the state of emergency following Hurricane Katrina in New Orleans. U.S. troops also arrived, something far easier to do even now thanks to last year's elimination of the 1878 Posse Comitatus Act. That forbid U.S. troops from policing on American soil. If martial law were enacted here at home, like depicted in the movie The Siege, easing public fears and quelling dissent would be critical. And that's exactly what the Clergy Response Team, as it's called, helped accomplish in New Orleans.
Jeff, the primary thing that we say to anybody is let's cooperate and get this thing over with, and then we'll settle the differences once the crisis is over.
Such clergy response teams would walk a tightrope between the needs of the government versus the wishes of the public.
In a lot of cases, these clergy would already be known in the neighborhoods in which they're helping to defuse that situation.
For the clergy, one of the biggest tools that they will have in helping calm the public down or obey the law is the Bible itself, specifically Romans 13.
Because the government's established by the Lord, and that's what we believe in the Christian faith. That's what's stated in the Scripture.
Civil rights advocates believe the amount of public cooperation may depend largely on how long they expect the suspension of their rights might last. Jeff Farrell, KSLA News 12 reporting.
And according to Tuberville, during Hurricane Katrina, the clergy response team provided 38 chaplains a day around the clock at 8 different camps.
This fight against Ebola, which as of today became a military matter, as we said, up to 3,000 American military personnel will be deployed into this hot zone in Africa at a starting cost of $600 million, all of it to combat an outbreak the World Health Organization called today, quote, unparalleled in modern times.
Faced with this outbreak, the world is looking to us, the United States, and it's a responsibility that we embrace. We're prepared to take leadership on this, to provide the kinds of capabilities that only America has, and to mobilize the world in ways that only America can do. That's what we're doing as we speak. And it's a reminder for the American people that should any cases appear in the United States, we have world-class facilities and professionals ready to respond, and we have effective surveillance mechanisms in place. Now, here's the hard truth. In West Africa, Ebola is now an epidemic of the likes that we have not seen before. It's spiraling out of control. It is getting worse. It's spreading faster and exponentially. Today, thousands of people in West Africa are infected. That number could rapidly grow to tens of thousands. And if the outbreak is not stopped now, we could be looking at hundreds of thousands of people infected, with profound political and economic and security implications for all of us. So this is an epidemic that is not just a threat to regional security, it's a potential threat to global security. So today I'm announcing a major increase in our response. At the request of the Liberian government, we're going to establish a military command center in Liberia to support civilian efforts across the region, similar to our response after the Haiti earthquake. It's going to be commanded by Major General Darrell Williams, a commander of our armed Army forces in Africa. He just arrived today and is now on the ground in Liberia. And our forces are going to bring their expertise in command and control, in logistics, in engineering. And our Department of Defense is better at that. Our armed services are better at that than any organization on earth. Next week, I'll join UN Secretary General Ban Ki-moon to continue mobilizing the international community around this effort. And then, at the White House, we're going to bring more nations together to strengthen our global health security so that we can better prevent, detect, and respond to future outbreaks before they become epidemics. This is actually something that we had announced several months ago at the G7 meeting. We determined that this has to be a top priority. This was before the Ebola outbreak. We anticipated the fact that in many of these countries with a weak public health system, if we don't have more effective surveillance, more effective facilities on the ground, and are not helping poor countries in developing their ability to catch these things quickly, that there was at least the potential of seeing these kinds of outbreaks. And sadly, we now see that our predictions were correct. It gives more urgency to this effort, a global health initiative that we have been pushing internationally. So thank you very much to the entire team that's already doing this work. And please know that you've got your President and Commander-in-Chief behind you. Thank you.
All right. President Obama is sending up to 3,000 American troops into the heart of West Africa's Ebola epidemic.
And so the administration announced today Operation United Assistance, sending 3,000 troops, including medical, engineering, and security forces.
Now, as we highlighted earlier this week, the Centers for Disease Control already has measures in place for dealing with an outbreak of a communicable disease. It'll allow for the quarantine of well persons who do not show symptoms of the disease. So obviously, they are already prepping themselves to have the authority to quarantine Americans. And why is that? Well, now they are bringing this highly deadly disease for which there is no cure to the West, because that's so intelligent.
Early diagnosis. Then you isolate the patient, you track down their contacts. And the CDC says we are totally set up to do that here in the United States.
We know how to stop Ebola. It's tried and true mechanisms of public health. Find the patients, isolate them, find their contacts, track them, and make sure infection control is done meticulously. You do those things and this Ebola outbreak will go away just as every previous Ebola outbreak will go away, but it's going to take time.
Your organization recently mishandled anthrax and the bird flu, exposing dozens of workers. I guess the point is mistakes do happen.
But never fear, because the U.S. government is already planning to take care of you. They've already been prepping for this Ebola outbreak. They say they're going to begin testing on people an experimental Ebola vaccine as early as September. Now, the National Institutes of Health's Infectious Disease Unit is working with the FDA to put the vaccine into trial as quickly as possible. Now, what could possibly go wrong? We've already heard, the experimental H1N1 was causing a lot of pregnant women to have spontaneous abortions, and that was in the thousands here with H1N1. We know the flu vaccines, they cause the flu or flu-like symptoms. So could this experimental Ebola vaccine cause Ebola-like symptoms? Or is it basically going to be like the opening scene of The Walking Dead or any other zombie movie you've ever watched ever in the history of zombie movies?
There are a number of vaccine candidates that are now being tested, and they are at various stages of development. By the end of January of 2015, we will know whether or not, in fact, it is safe, and we believe it will be, and whether, in fact, it does induce the kind of appropriate immune response that we're looking for.
Breaking news, the Centers for Disease Control just releasing a grim prediction for Ebola, forecasting up to 1.4 million cases of the deadly virus by next January.
The CDC estimates up to 1.4 million cases by January. That could happen if efforts to stop the disease aren't stepped up.
By the end of January of 2015, we will know whether or not, in fact, it is safe, and we believe it will be.
Now there are forecasts that without a huge boost in resources, 1.4 million people could be infected by early next year. The UN Security Council has declared the disease a threat to international peace and security.
A team in the UK has just begun human trials of a possible vaccine.
By late November, we'd like to have enough safety data and enough immune response data telling us how the vaccine is working for WHO and other international authorities to take the difficult decision on whether this is a vaccine we should go ahead and deploy by the end of the year.
There are now forecasts that 1.4 million people could be infected by mid-January if the disease is not contained.
By the end of January of 2015, we will know whether or not, in fact, it is safe, and we believe it will be, and whether, in fact, it does induce the kind of appropriate immune response that we're looking for.
I can understand why people are scared of Ebola. It's deadly, it's a gruesome death, it's a terrible, merciless virus. But I hope and I'm confident that our fears are not going to overwhelm our compassion. We care for our own. We bring people home if they need to come home, and we will stop the outbreak in Africa, but it's not going to be quick. It's not going to be easy, and it's quite possible we'll see it get worse before it gets better.
Dr. Davis in Florida wants to give us his take on this. Go ahead, Dr. Davis.
I think that from my perspective, running a biotech company that has a potential solution for this in a drug that we've developed and have worked with the Army on it, all of the emphasis right now appears to be on vaccines. And I think that that's a mistaken solution, because if you have hypermutation like you have in this particular viral strain, it's impossible to anticipate how it might mutate, which is the key to developing a successful vaccine. You have to look forward at where it's going to go, and you can't predict where this is going to go. So I don't believe that the vaccines that Glaxo or any of the other companies are trying to work on, even though I believe in those from a scientific standpoint, I simply don't believe that you can predict where this will go in order to make enough vaccines that'll make a reasonable protection for the population.
Sure. Well, you've been a guest on the show before. I'm glad you got in today. You want to write an article for us about that and send it over. We'd like to get your perspective on why an Ebola vaccine won't work at this point. Thank you so much for the call.
We have the kind of healthcare system and the ability to isolate and use the kind of containments that we do that is extremely unlikely, very unlikely, that we would even have the conditions for there being an outbreak. The American public should not be concerned about there being an outbreak in the United States because of our healthcare conditions.
Dr. Fauci was very reassuring. He said this virus is not mutating. It's not like the flu. We got a very stable virus here. We can predict its pattern. It's not easy to transmit.
White House Press Secretary Josh Earnest says the key is to control the epidemic before the virus mutates and becomes more easily transmittable.
If we failed to respond to this and we allow the virus to spiral out of control, there is the potential that it could mutate in a way that could end up being dangerous for people back here in the U.S. Right now, the risk of an Ebola outbreak in the United States is very low.
Ebola has been very steady. There's a few strains out there. They are not changing. This has been since 1976, when it was discovered, by the way, on a river in Africa. That's how it got its name, an Ebola river. It has not changed.
Now growing concerns, this killer disease could, I stress could,
be mutating, something that Dr. Ernest Patty said is a real threat. He's the senior attending physician of emergency medicine at St. Barnabas Hospital in New York City. Doctor, how real a threat is that, and why would it matter?
Well, the thing we have to remember are viruses are pretty hardy little creatures, you know. Common cold is a virus, influenza is a virus, and over time, they've both mutated at different times throughout history and caused different types of outbreaks. So it's something that we need to remember. But common sense has to dictate, and we have to, you know, not panic and flip out, but mainly try to keep a watchful eye on it and see how it spreads in the next few months.
We sequenced 99 samples from 78 patients that were the first patients diagnosed in Sierra Leone as part of the Ebola outbreak. And in fact, we captured 94% of patients diagnosed in Sierra Leone in the first 3 weeks of the infection. And the kinds of things that we could figure out from it is we could see that if you look at the 3 published Guinean strains, that these are all linked. These are all appear to be one chain of events. And particularly, we can really have a close view of what happened in Sierra Leone. And it seems like there was one entry into Sierra Leone that then spread throughout. We see hundreds of mutations, over 300 mutations that separate this virus from past viruses. We see about 55 mutations that have just happened within the course of this outbreak event. And we also see hundreds of mutations that are happening within individuals.
Meantime, the Centers for Disease Control and Prevention is sending out information to U.S. hospitals to become prepared if the virus were to hit American soil. On to at 11 tonight, News Center 9's Annie Hubble explains the new checklist and how local hospitals are already utilizing this information.
On the heels of President Obama's announcement of a major plan to step up U.S. efforts to mitigate the Ebola outbreak in West Africa, the CDC released a checklist to ensure U.S. hospitals big and small are prepared in case the disease hits home. The 6-page checklist details the best practices for hospitals and healthcare professionals to undergo if they were to treat infected patients. It suggests all staff members should have buddies to monitor and help train each other. Hospitals of all sizes should place greater emphasis on training, and even smaller clinics should train employees to deal with media attention. The East Alabama Medical Center says the checklist is similar to the procedures they have in place to treat viruses like MERS and SARS.
It's just a screening question for people that enter our ER if they've traveled outside of the country, and are they exhibiting signs and symptoms of a respiratory illness?
And are they exhibiting signs and symptoms of a respiratory illness?
That we could put them in isolation as soon as they enter our facility.
President Obama's plan is to send 3,000 troops to West Africa, open 17 treatment centers, and train thousands of healthcare workers to fight the disease. Even though the threat is low here in the United States, the CDC says, quote, now is the time to prepare.
As the infection prevention manager, we'll make sure that all our processes are in place, and the key people that need to be involved will be regarding that.
Ebola has killed at least 2,400 people and has infected thousands of others. Officials hope that this checklist will put hospitals one step ahead of the game if it were to ever land on U.S. soil.
Sean in Nevada is a doctor, works in an emergency room. Sean, thanks for calling in. Give us your take on the situation.
My take is that we may be dealing with something more than just spread by, bodily fluids. We get a CDC announcement today that you need to have a respirator, you need to have basically a level 3 biosuit to engage with these patients. That's becoming concerning to me that the CDC sends something out like that.
We want to know why the U.S. government is issuing guidelines to local funeral homes on how to handle the remains of Ebola patients.
So here's the question. Does the U.S. expect Ebola to turn into a serious health threat here? CBS 46's Jocelyn Cannell joins us now live from Decatur. So, Jocelyn, what'd you find out?
Well, Scott and Tracy, there are some 700 funeral homes across Georgia like this one right here, and the CDC has issued all of them guidelines like this one, advising how to handle the remains of Ebola patients, and we wanted to find out why.
Ebola first hit Georgia's soil this summer with the arrival of 2 sick American missionaries from West Africa. Both made full recoveries, but new guidelines from the Centers for Disease Control to U.S. funeral homes leave some questioning what's next.
The best we can do as a society is to do our best to prepare for it. That's what we've done.
Elisa English heads up the Georgia Funeral Directors Association.
More communication.
She's talking about this information from the CDC distributed to the state's 2,000 funeral directors. It says Ebola can be transmitted in post-mortem care. The recommendations to funeral workers are chilling. They include wearing personal protective equipment such as surgical scrub suits and avoiding autopsies and embalming.
How am I going to know you're okay?
We wanted to know, should people in Georgia be alarmed?
Absolutely not. In fact, if they weren't hearing about it, they should be a whole lot more concerned.
English says Georgia has one of the country's most thorough public health plans. That includes detailed planning for all hazards.
We have a plan for any kind of hazards, not just Ebola, pandemic flu, tornado, flood.
And she says the fact that every contingency is planned for should help Georgians feel safe.
The fact that they are on the job and preparing for any contingency should actually make people feel very good about what's going on.
And Georgia started working on its hazard public health plan about 5 years ago, and it continually updates it as new threats arise. We're live indicator Jocelyn Connell, CBS 46 News.
All right, the fear people have, Doctor, with this Ebola is that if it mutates and becomes an airborne type of thing, all bets are off. How likely is that? Do we ever see indications of that with something that isn't necessarily, taken up via, airborne, but that could?
Well, the chance is always there that it could become an airborne type of virus. I mean, like I mentioned earlier, I'm not an expert in infectious diseases, but watching these types of outbreaks over the past years, it's interesting to note the earlier outbreaks of Ebola were fairly contained quite early. And it just seems like this one is spreading a little more, further. Is it possible that it's spreading not just through the direct contact that was mentioned? Is it possible that it's, slowly mutating and becoming airborne? I guess that possibility
Let's say
exists.
It does then, Doctor.
Sure.
How does that change things?
Well, it changes things because coughing, sneezing, where you can spread these types of particles through the air where they travel further distances, is going to increase the likelihood that it can affect more and more humans in a quicker fashion. More of like the outbreak scenario.
Right. There might be a lot of people out there who are not exhibiting any of the symptoms that would get them kicked off a flight, for example, but who later might. Well, how do we know?
There's really no real way to know. I mean, the problem with Ebola is it exhibits symptoms that are similar to many other viral diseases. The malaise, the headache, the high fevers, the nausea, the vomiting. These are things that you get in practically almost any viral disease. And especially folks coming from malaria, we have to make sure that they're not suffering from malaria, which you get many of the same symptoms and characteristics from. So we have to rule out the malaria first, but also keep in the back of our mind that, is it possible it's Ebola? Today with air travel, the problem with air travel is, as convenient as it is for us, it also allows infectious disease to travel so quickly between
it's like
countries.
A petri dish.
Exactly. I mean, in the old days, in the 1600s, we spread disease via, long ocean voyages on ships, and explorers spread disease that way. Today, any citizen can spread disease by just getting on a plane.
Well, emergency room work and all of that. How do you think those caring for, let's say, for someone who comes in with the Ebola virus?
Right.
What precautions should they take? Are they likely to take?
Well, fortunately, we practice every day standard infection control precautions. We do isolation for patients with fever, rash, things of this nature. So obviously we have to look and see if a person comes in exhibiting these signs and symptoms, has been in one of the affected areas, say within the past 21 days, that should put us on high alert and allow us to maybe isolate them sooner. The quicker you recognize it and isolate that particular person, we put on our protective gear.
But Doctor, what if, to your point earlier, that we don't know that this person who's waiting in the emergency room with 100 other people only later exhibits these symptoms? In that interim, he or she could have risks contaminating others, right?
He could have. So what we do then is we always have lists of who's on shift, and we get those folks and we bring them in for evaluation. I mean, these are what we call exposures. We have the safety practices in place. The thing is, we have to remember to practice those safety practices.
Now, we've been telling you for weeks that this virus keeps mutating, and Dr. Jorge Rodriguez is worried it's not long before it could become airborne. It could. Explain.
Yeah. Absolutely. Listen, a virus, and anybody that's infected with Ebola has approximately 20 billion viruses every day. And the genetic material of a virus is basically like a necklace with many multicolored beads. And a replication should be exact. You change one of those beads, and instead of putting a red bead, you put a blue bead. That changes the whole consistency of the virus. You now have thousands of people, who knows exactly how many, with this virus, and it's replicating. There is bound to be, with time, a mutation. And one of those mutations could easily make this virus airborne. And then this thing would just skyrocket. So that's why everybody's so scared, and rightfully so.
What happens and how likely is it when something gets airborne, when something that could not be transmitted just in the air suddenly can be?
You know what, Neil, it would be disastrous. Right now, this is still highly contagious. Why I think it's so contagious in Africa is because the infrastructure is so bad. People aren't educated. They're carrying, corpses and bodies and even clothing tainted with blood. Airborne, you could be in a plane, somebody that has Ebola coughs, and 6 people around them all of a sudden catch it. That person gets off at, Charles de Gaulle, coughs a little more, spreads it to a few more people that get on another airplane. One goes to Prague, one goes to New York, the other one to LA. You get the picture. That's the difference between bloodborne and airborne. It's very scary if that happens.
All right, we should stress we're not there yet, but you always fear that.
Not at all.
Rodriguez, thank you very much. Good having you again.
Dr. Noseworthy, what do we need to know about Ebola as it is a threat right now?
Ebola is a very infectious virus, not as contagious as some because it's not spread by airborne contact.
It's interesting to note the earlier outbreaks of Ebola were fairly contained quite early. And it just seems like this one is spreading a little more, further. Is it possible that it's spreading not just through the direct contact that was mentioned? Is it possible that it's, slowly mutating and becoming airborne? I guess that possibility
Let's say
exists.
it does then, Doctor. Sure. How does that change things?
Well, it changes things because coughing, sneezing, where you can spread these types of particles through the air where they travel further distances is going to increase the likelihood that it can affect more and more humans in a quicker fashion. More of like the outbreak scenario.
Right.
Alex Isaacoff was in charge of transporting Brantley through Atlanta's streets. He was in that SUV behind the ambulance.
If I had Ebola and I was touching your hand, maybe you would be at risk for contracting it. If I coughed and sneezed in your face, you would be at risk for contracting it.
If I coughed and sneezed in your face, you would be at risk for contracting it.
But that's how it's transmitted.
So it's very infectious. So one particle of virus can cause a lethal infection. Almost 50% of the people who get infected with the virus will die of it, in spite of our best efforts to save them. So it's a big problem.
Now, to this day, in the airports, you still hear people talking about they're fearful that somebody's going to get on a plane from one of these countries and they're going to somehow spread it to passengers on that plane. And then people who aren't even flying or here at home are worried about sitting next to somebody on the subway that just got off of one of those planes. Is that still a real threat to have Ebola spread here in the United States?
It's a possibility that it could come to the United States, so preparedness for the public and for hospitals is terribly important, and we're very active.
Do you feel that our hospitals are ready?
I think they're getting ready around the country. They know they need to because this is a public health emergency at a global scale, and so it has to be taken seriously.
First and foremost, I want the American people to know that our experts here at the CDC and across our government agree that the chances of an Ebola outbreak here in the United States are extremely low. We've been taking the necessary precautions, including working with countries in West Africa to increase screening at airports so that someone with the virus doesn't get on a plane for the United States. In the unlikely event that someone with Ebola does reach our shores, we've taken new measures so that we're prepared here at home. We're working to help flight crews identify people who are sick, and more labs across our country now have the capacity to quickly test for the virus. We're working with hospitals to make sure that they are prepared and to ensure that our doctors, our nurses, and our medical staff are trained, are ready, and are able to deal with a possible case safely.
Good evening, and as we come on the air tonight, we're covering a major development in the Ebola outbreak. Until just a short time ago, in fact, Americans could at least take comfort in the knowledge that all the thousands of cases of this deadly virus were discovered outside of our borders. But a late announcement tonight from the CDC just changed that. The first case has been confirmed here in the U.S.
We begin with breaking news this evening. For the first time, Ebola has been diagnosed inside the United States. Dr. Tom Frieden of the Centers for Disease Control announced late this afternoon the patient was infected in Liberia and is now in an isolation unit at a Dallas hospital.
It is certainly possible that someone who had contact with this individual, a family member or other individual, could develop Ebola in the coming weeks, but there is no doubt in my mind that we will stop it here.
U.S. hospitals have treated several other patients who contracted Ebola in West Africa, but were diagnosed before returning home.
The CDC confirms the first diagnosed case of Ebola here in the U.S. Until today, the outbreak had been centered in Western Africa, but we learned this afternoon a man being treated right now, in fact, he is staying at a hospital in Dallas and he has been diagnosed with Ebola.
The CDC says this man was not a healthcare worker helping to treat victims, and he may not be an American. The CDC simply says he was visiting family when he showed symptoms of Ebola.
Until now, the virus has largely been confined to West Africa, but late this afternoon, the Centers for Disease Control and Prevention confirmed the first diagnosed case of Ebola in the U.S.
A terrifying confirmation. Ebola has hit the U.S. The CDC now saying it has diagnosed the first patient in the country with the highly contagious virus. Tonight, he's in a Dallas hospital under strict isolation. The question now is whether the disease ravaging Africa tonight will spread here.
They undoubtedly had close contact with someone who was sick with Ebola or who had died from it.
Since the diagnosis came almost a week later, those who were in close contact with the patient will be monitored for the next 21 days. The virus is spread through bodily fluids.
The likelihood is we will certainly see more cases of Ebola.
Fox 29's Dr. Mike says most Philadelphia hospitals should be equipped to handle such an outbreak. But it wouldn't take much for the disease to spread quickly on U.S. soil.
For the first time, the Ebola virus is in the United States. The patient in isolation after being diagnosed at a Dallas, Texas hospital. CDC Director Dr. Tom Frieden joins us right now, live from Atlanta, Georgia. Good morning to you, Doctor.
Good morning.
We asked folks if they had any questions for you, and we have hundreds of questions. Somebody coincidentally by the name of Sally, my daughter's name, wrote this. Why are we not stopping air travel between Liberia and other nations struggling with the virus? Why allow flights into the United States, Doctor?
The bottom line is that the best way to protect Americans is, first, stop it at the source in Africa. Second, make sure that every single traveler who leaves the countries where Ebola is spreading gets screened for fever, and CDC teams are on the ground and have made sure that that happens 100% of the time. And third, make sure that doctors and other health workers in this country think about the possibility of Ebola in anyone who's been in West Africa for the past 21 days and test them and isolate them if they have been. You know, the impulse might be to isolate these countries. If we do that, we'll actually be increasing our own risk because really the simple truth is by stopping it there and by helping them stop it there, we're helping ourselves.
During your press conference, you talked about how this guy's family there in the Dallas area, you're monitoring them. I know 3 of the emergency workers who drove the ambulance are being monitored. What about the people who were in the emergency room when he first came in and said, I don't feel good, and they said, take some antibiotics, go home? Those people are being monitored too, right?
We have a 9-person team in Dallas working with the hospital, with the health department, and the family to identify every possible contact. Good. And we'll be monitoring every one of those individuals for 21 days. Okay. That's the tried and true public health means of stopping an Ebola outbreak.
One other theme we got on the email, Doctor, was this, and this is a political thing, but you're part of the administration. They feel that the administration has misled a lot of people on a lot of things. Why should we believe you when you're telling us this stuff?
We're learning a lot of troubling things about this case that we should lay out there. First of all, in Monrovia, Liberia, just before he left for the United States, he was helping to transport a woman who was dying from Ebola to the hospital, then carried her back into her home. She died hours later. The guy who was helping carry her died later as well, and yet this guy got on an aircraft and flew to the United States. When he got here and became ill, last Thursday night he went to the hospital. He told them that he had just traveled in from Liberia. This hospital had just had a review of their Ebola protocols, yet they gave him some antibiotics for what they said was a low-grade viral infection, and those two things don't go together, and then they sent him home. Apparently the word was not passed. Hospital official Mark Lester picks up the story from there.
The overall clinical presentation was not typical at that time yet for Ebola. So as the team assessed him, they felt clinically it was a low-grade common viral disease.
So they sent him home and they sent him back to this apartment complex where he was mingling with family as he was getting increasingly ill for 2 days. 5 of those family members with children who the day after he went to the hospital in an ambulance went to 4 Dallas area schools. Governor Rick Perry trying to allay parents' fears by saying the kids were not symptomatic, so it's highly unlikely that anyone had the virus transmitted to them. We're learning more about this guy's travel, by the way, too. He started off his journey in Monrovia, Liberia, flew to Brussels, Belgium, then to Dulles, just outside of Washington, D.C., finally on to Dallas. 2 of those flight legs were United Airlines flights, Flight 951 from Brussels to Dulles, and then Flight 822 from Dulles to Dallas. United Airlines is urging anyone who is worried about being on that aircraft with Thomas Eric Duncan to contact the Centers for Disease Control. Guys?
All right. Now, John, just a moment ago, you were talking about how of the people, and now we know that he was in contact with 80 people, we know of at least 5 or 6 children who went to school earlier this week. There's a headline out of the Dallas Morning News today that says, wary of Ebola, Dallas parents pull their kids from school. And you got to figure if your kid went to any of the schools where any of these other children were, you might think the same thing.
Yeah, you know, as a parent myself of 3.5-year-old twins, after having raised 2 previous to that who all went through public school, a parent does worry about something like that. Should I send my child to school? The independent school district there in Dallas and the Department of Health in Dallas County doing everything it can to try to reassure parents that it is safe for their kids to go to school, saying that there's almost 0 chance that this virus can be transmitted if somebody's not showing symptoms. And the Dallas County Health and Human Services Department has told 4 family members, stay at home, do not go out. And they're telling them that you've got to stay there until October the 19th. They actually have an order ordering them to stay in the home. So if they were to try to leave, they could probably actually, under the statute, arrest them.
They're saying stay at home, though. They're not putting them in isolation. It would seem that isolation...
Not at this point, no, because, well, not at this point. They are what's called sort of self-isolated.
Okay. There are some other things we know about. He was identified by his sister to the Associated Press. The story goes that about 10 days, 2 weeks ago, he was, while in Liberia, that man right there, Thomas Duncan, was helping his neighbor who was pregnant and dying. She had Ebola. They were trying to get her to the hospital. They called the ambulance. It didn't come. Put her in a private car. He was carrying her by the legs. That apparently is how he got infected. Also, the big trip from Liberia took him 28 hours. He rode on 2 airlines. What's curious is the federal government said, we're not going to tell you anything about the airlines because everybody's going to be safe. United Airlines said, you know what, we're going to tell people. So we do know that he took Brussels Air from Liberia to Belgium. Then he took United Flight 951 to Dulles. He had a 3-hour layover there after a 7-hour layover in Brussels. And then he took United Flight 822 to Dallas-Fort Worth.
Right, the level of potential exposure there seems more exponential this morning as you look at that map.
You would think so, but the government says because he didn't have the symptoms, he didn't have the fever, he wasn't vomiting, he didn't have diarrhea, people are safe, the government says. We had the director of the CDC on with us yesterday. He said, because one of you had a question and I asked it, and that was, why don't we stop the air travel between the United States and Liberia? And he said, you know what, air travel is fine because we're monitoring people as they get on the airplanes. Their temperature is taken, they fill out a questionnaire. But you know, if somebody's sick, and somebody really wanted to get to the United States, are they going to be honest about something like that? We had somebody else emailed us yesterday and said, okay, they're taking the temperature getting on the airplane. Why don't they take the temperature when people are getting off the airplane as well?
And when anyone comes down with a virus, you know that threshold between feeling kind of okay and then all of a sudden your symptoms are full blown can occur. You can miss that point, and clearly that's what may have happened here, in addition to a lack of communication to superiors, as it seems, in that hospital.
So it's this guy, Thomas Eric Duncan from Liberia, the first person in America diagnosed with the virus. He most likely contracted the disease while at home in Liberia before making his way to the U.S. through Brussels, Belgium, and then across to Dulles Airport and finally to Dallas for his family visit. Duncan in isolation now, and his close relatives are being told to stay home or face arrest. As many as 100 people being monitored after coming in contact with family and medical workers who had contact as well with Duncan. Despite his diagnosis, the CDC says it's not informing other passengers on his flights.
At least 100 people may have been exposed to the deadly virus, a significant jump from the initial reports that we got. Thomas Eric Duncan, a Liberian national now in stable condition at a Dallas hospital. Right now, there is no cure for the virus, but there are new experimental drugs in development that have worked to help in the past. So what do you need to know about this threat? Joining me now, Dr. Mary Schmidt, infectious diseases specialist. Doctor, thank you for your time today.
Thank you, Shannon, for having me.
All right, I want to ask you about something that you pointed out in the research, that it's been identified that the Ebola virus can survive on surfaces for up to 6 days after contact. That's not something I'd heard before.
We know it can survive. There was one study that I found that did show that it can survive for up to 6 days. That was a maximum. They weren't sure if there might have been some additional laboratory contamination. But this is one of the questions that we don't understand. This is one of the pieces of the epidemic that we don't quite understand.
And this is a political thing, but you're part of the administration. They feel that the administration has misled a lot of people on a lot of things. Why should we believe you when you're telling us this stuff?
In West Africa, we are surging the response not only of CDC, where we already have more than 130 people in the field, but also throughout the U.S. government. The president has leaned forward to make sure that we're acting very proactively there, and the Defense Department is on the ground already strengthening the response. We're working with USAID and other parts of the U.S. government, as well as with a broad global coalition to confront the epidemic there. But ultimately, we are all connected by the air we breathe.
We are all connected by the air we breathe.
And we are invested in ensuring that the disease is controlled in Africa, but also in ensuring that where there are patients in this country who become ill, they're immediately isolated, and we do the tried and true core public health interventions that stop the spread of Ebola.